After ankle arthroscopy, patients can expect to be in a boot or splint for the first 2 weeks after surgery. I would expect them to be non-weight bearing for the first 2 weeks and need to rest and elevate their foot above their heart as much as possible for the first 3 to 5 days after surgery. At 2 weeks after surgery, typically we go into a removable boot and begin walking and putting full pressure on the foot and start exercises to improve ankle range of motion and strength. Typically it takes 3 months to recover from an ankle arthroscopy and get back to normal activities. Ankle arthroscopy can frequently be combined with other procedures, including lateral ligament reconstruction, medial ligament reconstruction, or repair of ligaments and tendons around the ankle to try and address multiple pathologies around the ankle at the same time.